First News at 4 on KBTX.
Falls, what can seem like a simple fall. Yes, it's a serious risk to health and well-being for a lot of older adults in our area. And if you live out in those rural areas of the Brazos Valley, the effects can be even worse because of greater travel times, longer waits to get the proper care that you might need. Matthew Lee Smith joins us now. He's the co-director of the Texas A&M Center for Population Health and Aging. He's led a research team to examine fall prevention programs in rural areas. And Dr. Smith, what did you find? Do we have fall prevention programs in these rural areas?
You know, there are a lot of fall prevention programs throughout the United States in urban and rural areas. And yes, about 19% of our programs were delivered in rural areas, but that reaches thousands of Americans and older adults, but there's millions that need more service.
So I touched on it a little bit about why these programs are particularly important in rural areas, but in your words, based on your research, why do we need to make sure that people in rural areas have access to fall prevention programs?
So about 1 in 4 older adults will fall each and every single year.
Yeah.
So with that said, in rural populations, oftentimes there's longer distances to travel to healthcare resources. So if we can actually have an emergency occur, we need to be able to get that person the help they can very quickly. So a lot of times in rural areas, the resources are fewer and it's longer distances to get to help. So if we can integrate programming and have people take these kinds of programs, learn how to prevent falls and manage a fall, then we can be more successful with those older adults to ensure they have a healthy, active lifestyle.
Great. So this is a lot of if we can do this, then it'd be great. So can we do this?
Absolutely, we can do this.
How do we do this?
Phenomenal programming all throughout the United States, here in Texas. And if anybody wants to contact our Center for Population Health and Aging or the local Brazos Valley Area Agency on Aging, we can tell you more about some of the different programs that are available. What we're trying to do is offer these programs through our community partners to bring them closer to home to older adults in rural communities so they don't have to travel these long distances and multiple miles.
In our last 30 seconds or so, give us the whole program. What is fall prevention? I mean, what are older adults or their caretakers learning in a fall prevention program?
So many different types of programs, and we examined 8 of them. A Matter of Balance, Tai Chi, Otago exercise programs,
Really?
So many different types. What we try to do is have older adults understand that falls can be prevalent, but they are largely preventable. And so we encourage them and educate them to look at their medications with a physician and understand what those medications do, getting their eyes checked, looking at their home environment, making sure that the lighting is appropriate. There's no ottomans or tripping rugs, grab bars in the bathrooms, but also making sure that they're active, physically active, so that they can have strength, they can have balance, flexibility. Get into these programs. They're really a wonderful resource.
See? And all of that in 30 seconds. Imagine what this guy can do with a full-length program to help the older adult in your life, or maybe you yourself, prevent what can be a very, very damaging fall.
Agreed.
Matthew Smith from the Center for Population Health and Aging. Thank you so much. Appreciate you.
My pleasure. Thank you.